Hello, hello, and welcome to Valley View University. My name is Dr. Stephen Williams, and really excited to have everyone joining today. Thank you for signing up. Um, so I would wish I could see you all faces in person, but this is the next best thing we have to be able to kind of capture everyone from across the Western Slope and Valley. So thanks for joining. Um, Let's see here. I need to get over to our presentation today. And as I'm doing this, a couple of housekeeping items to go over. You can submit questions through the Q&A chat, which you'll see at the bottom of your screen. So at any point during the presentation, just submit the question. And it might be answered during the presentation by our nurse practitioner, Ashley, or certain questions you may say these are good to kind of go over for everyone listening, and then we'll answer that question at the end of the presentation. So I'm going to go through the presentation straight up and be about 20-25 minutes. We'll take questions during that time, and then we'll spend the last 25-30 minutes as much as needed to answer all your questions and that come up. So just a quick thing, we're unable to answer any questions regarding personal health information. So if there's specific medical questions you have about yourself, those we can't answer due to keeping patient identity, everything private. But certainly you can always reach out to Rocky Mountain Urology and ask to talk with me or my colleagues here to get those personal questions answered. Okay, so without further ado, we'll get going into the talk today, which is going to focus on prostate health and in particular prostate cancer and how we check for prostate cancer, particularly using PSA blood tests. And let's see here. I want to make sure I can get forward to the next thing. So, yeah, I'll use it down here. Yeah, so just some quick background, because I'm new to the Valley and moved here about a year ago with my wife. But I'm from the East Coast, born and raised in Philadelphia, and as any native Philadelphian will tell you, they're typically huge sports fans. But I spent the last 30 years in California, where I did my residency training, and then last 25 years in Southern California, particularly, where I did my fellowship in urologic cancer surgery at USC, University of Southern California, under the tutelage of Dr. Skinner, who you see here, who's my mentor, and I am forever indebted for everything I learned from him, and I'm able to, I've been trying for the last 25 years to spread that wisdom to all my patients. But we moved out here to after the kids were grown and working and try and get a better quality of life. There's about 20 million fewer people here in the Western Slope than Southern California, but we love the outdoors. And even though you see a picture of me playing golf with my two sons, I'm a golf beginner, so not very good, a long ways to go. A quick thing about the prostate, it's a big topic in men's health. Usually, as we get older, usually younger guys are really not too concerned about it, but it is a very important organ and is particularly responsible and necessary for reproduction and having children. It provides fluid and nourishment for the sperm to swim and do their things. Prostate actually does not control any sexual function other than that. It doesn't control erections. And there are nerves and muscles around there that do relate to that, but the prostate specifically, that's not part of its job. But the real problems occur later in life. And that's where urinary issues and cancer can develop. And that's where much of the concern comes for men as they get into their 40s and 50s. An important factor to keep in mind, the prostate grows in response to testosterone. So from the time child goes through puberty, testosterone release is high in the bloodstream. All the changes we know about puberty, but the prostate starts growing at that time and actually never stops growing. So it's going to keep growing throughout the lifetime of a man. And that's important as we go into some other slides here along the way. So quick overview, we're really talking more about the aging prostate as men get in their 40s, 50s, 60s, and beyond. There are three main things I want to focus on. Prostate enlargement, otherwise known as BPH, occurs in all men. And every single man, as long as there's testosterone going around, the prostate's going to get bigger. Eventually will cause some urinary symptoms. For some men, it starts in their 40s, other men not till their 60s or 70s, but all men will develop some urinary symptoms from enlarged prostate. On the other hand, prostate cancer occurs only in some men and does not have symptoms. The only time we see symptoms from prostate cancer is when it's very, detected late and very advanced, and that's not a good thing. Fortunately, we have a great blood test called PSA, which we'll talk about, that can help detect prostate cancer early. And then we'll spend a little bit of time at the end talking about prostate health and supplements and some thoughts on that. So a quick word on prostate enlargement, otherwise known as benign prostate hyperplasia or BPH. Very common, as we talked about, significant men's health disease. Really the number one reason men come to visit the urologist because of changes in urination that occur as the prostate enlarges over time. It kind of squeezes the channel that the bladder is trying to push the urine through and out. And that creates the slowing of the stream, sensations of not being able to empty very well, but very common for men, particularly after the age of 60, to have these symptoms. And these typical symptoms that will affect most men: getting up at night more than once, not emptying your bladder when you go, or you feel like you have to go again in the next 10, 15 minutes, or I can't hold it as long. If symptoms are really starting to affect your normal routine, that indicates things are a little further along as far as prostate enlargement, and definitely important to tell your doctor, ask to see a urologist to kind of get more information on that. We have many good treatments to treat enlarged prostate in men that are struggling with urinary symptoms. We have great medicines, which you only need to be taken once a day. We have minimally invasive surgical options for men that either don't want to take medicine or can't tolerate medicine. And we offer all of these at Rocky Mountain Urology. And if you're interested in learning more about these in depth, you can certainly call our office, but also in the comments section at the end or the survey, say, hey, I want to hear more about prostate enlargement and treatments for it, and we can go into detail on that at a future time. But I want to focus mostly on the hidden problem with the prostate, which is prostate cancer, because again, it rarely causes symptoms. And so you can't rely on that as a sign of prostate cancer. Thankfully, we have a blood test developed in the mid 80s. It's been in practice since the late 1980s, early 90s, that we can check for prostate cancer with a simple blood test called Prostate Specific Antigen. Important thing about this is it is produced by all prostate cells. Normal cells that are enlarging produce some PSA. Cancer cells tend to produce a little more PSA. And this all gets released into the bloodstream. So the blood test will give us information about the total amount of PSA in your body, but then the next step is to differentiate what could be related to enlarged prostate or what PSA may be more concerning for cancer. So we'll talk a little bit about that. Quick word on prostate cancer, and this really applies to most cancers in how for any organ. Basically, cancer is normal cells in any particular organ in the body that start to grow abnormally or grow abnormally fast. In the case of prostate cancer, it's a very slow growing cancer for the most part and grows over a period of years. When it's detected early, ideally with PSA testing, it's almost always treatable, curable, but again, the key is catching it early. So we catch it and we do tests and biopsies and we find a little spot of cancer like here, no problem. That's going to be easy to treat. If you haven't been getting PSAs or not been seeing the doctor and we catch it and it's a little more advanced like this, now that's a more difficult cancer to treat and has higher likelihood of spread. So the key is catch it early, and successful treatment the success rates are quite high. So a quick word on who needs to get a PSA test, because not all men need this. And in particular, prostate cancer occurs in older age, starting around 50s into the 60s and 70s most commonly. So any man who's 50 to 70 years old in good health should be getting a PSA check once every year or two. There's the men who are older than 70, but still in good health, and based on many different life expectancy tables, those men might live another 15 to 20 years at least. They also may benefit from PSA screening. So in terms of when to stop checking PSA, stop checking for cancer, really depends after age 70 on your health. An important factor to mention that if you have a father or brother who developed prostate cancer or African American descent, your likelihood of getting prostate cancer earlier and potentially more aggressive cancer is higher than normal. And you want to get your PSA check sooner at age 45. So I even patients who I know have a family history, I tell them, look, age 40, start getting a PSA once every year or two. We develop a baseline that'll help as you get older to interpret the results of the PSA. And as you may have figured out, younger, healthier men are the ones more likely to be affected by prostate cancer in their lifetime because it's a slow-growing cancer. As we get older, you develop things like heart disease or kidney disease or lung disease, things like that. They end up being probably a more serious health issue, and prostate cancer not as important. So the key is PSA, getting it checked leads to early detection of cancer. Okay. And we'll go through kind of some examples of what PSA results look like in just a second. But a quick word, since 2010, we've actually been seeing less men getting PSA checks. It was a result of a very controversial statement from a U.S. government task force on PSA testing, where they recommended that it was no longer important to check. And it was based on some faulty data, looking at some research results and ignoring others. And unfortunately, what happens is in the last 15 years, or particularly for about a 10-year period, we saw a lot of prostate cancer that was being detected later. And once prostate cancer spreads, or the term is metastatic, it cannot be cured. We can slow it down with medicine, but you cannot cure it. So we really want to catch it early. And the sad thing is, in 2019, we were seeing rates of prostate cancer spread or metastatic prostate cancer that were at the highest since before we even had PSA testing. So it was right back, going back in time. So thankfully, a lot of research has been done in the last 10 years, and recommendations have changed. And in 2024, we're getting back to where most men are getting their PSA checked at the appropriate time and starting to catch the cancer early again. So if you're getting your PSA checked, you want to know what's normal, what's not normal, when do I see the urologist? And as you can see from this reference range chart, the PSA result, and these would be normal PSAs for any age group, the number goes up as you get older, because as you get older, your prostate is going to get bigger. It's going to release more PSA into the bloodstream, and we expect a higher number. Okay, when you're younger, we expect a much lower number. So bottom line is we want men to start getting PSA checks every 1 to 2 years. At least by age 50, again, family history, African American descent, you want to get checked earlier. But if you're getting it checked every 1 to 2 years, then each man's going to be able to have their own PSA individual baseline that we know to compare to. And what happens with prostate cancer is we usually detect it when the PSA is rising over time. So that's where you have that baseline and maybe 5 to 10 to 15 years of PSAs, and we're much better at identifying prostate cancer early. So just a couple of examples I think that will help for reference. So one example would be a 54-year-old gentleman who maybe didn't get PSAs checked quite at age 50, but now is getting them, and the first couple come back kind of high, 5.7, they check it again, 5.4. From that reference range, that's on the high side, higher than it should be for a 54-year-old, at least for many. And another example would be a 65-year-old gentleman who has been getting the PSA check for years, maybe 10, 15 years, always been pretty low, maybe in the 1 to 2 range. But now the last 3 to 4 years, we're starting to see a rise. That also could be an indication of prostate cancer. In both these examples, should be referred or asked to see a urologist to kind of gather more information. In most cases like this, we would do additional blood or urine tests. There are many different ones that we can use to help figure out if prostate cancer, this could be concern for prostate cancer. Often we may want you to get an MRI scan of the prostate to look for small areas of cancer that may be growing. The MRI scan is not perfect and can't detect prostate cancer specifically, but it gives us another piece of information to say there's some concern here. And if in fact either of these number of tests that you may have indicate possible prostate cancer, you're usually going to be recommended you want to go a prostate biopsy, which is the only way we have to definitively say someone has prostate cancer or not. So quick word on prostate biopsies. They've been around for a long time. And for the first many, many years, up until not too long ago, all biopsies were done through the rectum, what's called a transrectal biopsy of the prostate. It was done in office under local anesthesia. Could be kind of uncomfortable for men if you've ever had them. We were doing better in recent years at using MRIs to help guide the biopsies, but the real problem was due to the amount of bacteria in the rectum and the high use of antibiotics in the last 50 years in trying to prevent infections, we started to see a lot of resistance and resistant bacteria develop. And so on average, 5 to 7% of men were getting infections after biopsies, usually not too severe, needed antibiotics, but some could be quite severe and men need to be hospitalized. And just, that's an incredibly high infection rate for any procedure done in a hospital or office, 5 to 7%. That was just too high. And so as a result, there's been a gradual transition over to transperineal biopsy. Europe has already made this transition for the most part. US is a little slow to make this, but transperineal biopsy, which is the only way we do biopsies at Rocky Mountain Urology for the last year, is done through the area just above the rectum and below the testicles. There's an area called the perineum about 2 inches wide that allows us to go through the skin, which we can clean and avoid all bacteria. And there's actually a 0% infection rate on virtually every study across the world done to date on this type of biopsy. So, the old way we would go through here and take biopsies through the rectum, and there could be bleeding and in addition to infection. In the new way, we go through the perineum. And the thing that we've really changed here is we're doing all these in the operating room for now, where patients go through a light anesthetic, much like if you've had colonoscopy. So very easy for the patient to go through. And the other thing that's interesting is, oops, sorry, what's happening here? Give me a second. That in many studies, we're detecting cancer better. And I say better in the sense that on the first biopsy, we can often detect the cancer that's there. Going back 20, 30 years in my practice, there were times guys were getting 5 and 6 and 7 and 8 biopsies through the rectum over a 5 to 8 year period. And so we know now that we can hopefully get everything figured out on a single biopsy and not need lots more biopsies. So again, the key, detect prostate cancer early. We have many treatment options that we offer here at Valley View, depending on the stage and grade of the cancer, how advanced or hopefully how, caught early stage. This is not the forum to go through that because I could talk to you for a couple hours about different prostate cancer treatments. But if you're interested in learning more about that, put it on the survey and happy to give a presentation on how we treat prostate cancer and different options and things like that. So just a final word on prostate health, which is, again, always big in the news and certainly big in terms of supplements. And I think I can safely say that there is no over-the-counter supplement that you can buy, meaning not prescription, nothing prescribed by a doctor. This is over-the-counter. You can go to the pharmacy or grocery store. There's nothing you can buy that will prevent prostate cancer or prostate enlargement. I only put 2 here, saw palmetto and selenium, but I could write a list of 30 things that have been studied over the last 30 years in terms of supplements. None of them can prevent, and not even super beta prostate, which is the newest one that's out there, or a common one that's out there. And so you can't prevent things. You might be able to treat symptoms a little bit with one particular type of supplement, which I'll mention in the next slide. But in general, it's going to happen. And so really it's prescription medication if men start to have trouble with urination. I just a brief word on testosterone replacement therapy, because that's a big thing, and I found it to be quite big, actually here in the Western Slope, more so than even when I was in Southern California. There, very few men have truly low testosterone, and when we measure all the different hormones associated with male sexual function. It's a very detailed process to go through a urologist or endocrinologist to find out about if you have low testosterone, but it's quite rare. And for men that go on it when they don't need it, the higher the normal levels of testosterone can be harmful. They can make urination symptoms worse. You can completely cause the testicles to fail and they never recover. So you're on testosterone for life. And it can cause an imbalance of other male hormones. So in the right person, it's very helpful and it's safe, but for most men, not necessary, and certainly can affect prostate health in a bad way. The one thing I can recommend on a supplement level is beta-sitosterol. There's been quite a bit of research in recent years. The best we can say is that younger men who have mild symptoms, maybe some early prostate enlargement, may benefit in terms of the urination gets a little better, not nearly to the extent that prescription medicines have that work incredibly well. But again, over-the-counter supplement appears to be safe, may benefit young men with mild symptoms. That's really the only one. What I would absolutely recommend is a healthy lifestyle. We're talking about healthy diets that are avoiding fast foods, processed foods, and regular activity and exercise. These things, and we can go into more detail this at a later time, but these are the best predictors of a long, healthy life, and honestly, the best preventative medicine. And I just put a couple things down there that the research on looking at getting your heart rate up for more than 30 minutes a day and doing weight resistance exercises where you're lifting weights or pushing weights, those two things, the evidence supporting these in terms of reducing heart disease, improving brain health, reducing cancer rates, the research is overwhelming supporting this and far exceeds any research on supplements, which, by the way, don't have to go through rigorous testing in this country. So I'm a big fan of men's health and longevity and things related to this. So I've done a lot of research on this and just on my own to try and understand it better. So happy to talk about that in the future if you guys are interested to put that in the survey. So important factor, if you take away anything, if you have any questions about the prostate, you're worried about symptoms, you're worried about PSA or prostate cancer, seek medical advice early. Do not wait. Most of the time, I'll see men and they've got some minor symptoms or PSA we're not too worried about, and we'll be able to talk it out and don't need to do much, keep an eye on things. But please, please, please talk to your doctor early or talk to your urologist and we can kind of help sort things out. So I want to thank everyone for listening today. I'm going to stop there so we have time for questions. And please send us your comments. Again, other topic suggestions are always welcome. We want to hear about them. Okay.
Okay.
So we got some questions here to go over.
Does a naturally very high testosterone level carry a higher risk?
Excellent question. Okay, so the question is, does a naturally higher testosterone carry higher risk, I presume, of prostate issues, whether it be prostate cancer or enlarged prostate? Excellent question. We really don't have good evidence to say that's the case. If it's a natural, just to give you an example, the total testosterone measurement, which is just one way we measure testosterone, is usually between 300 and 800 for 98, 99% of men. Certainly under the age, younger age, those numbers you can get a little lower testosterone as you get older, but it's usually not significant. So if your PSA, if your testosterone is in the high 700s or 800s, even at age, 40, 50, 60, you're not necessarily at any increased risk. The risk comes when you're taking extra testosterone or supplements that can increase your total testosterone above that 800 number. That's where we start to see some of the problems. But no, so if you're in a relatively normal range on the testosterone measurements, you're not going to be at any increased risk.
What are adverse effects of cycling on the prostate?
Oh, great question. Okay, and a common question I get: what are the adverse effects of cycling or bike riding You could argue mountain bike, road bike, gravel bike, whatever it may be. This has been studied a lot. And early on, it was studied as far as PSA being affected. Bottom line is there's really minimal effect on your PSA level, even if you're riding the bike 4 or 5 hours a day. And all the studies that were done, and that include drawing PSAs hours after men got off a bike, the rise in PSA is so minimal, we say it's not clinically significant. The one exception was some studies looked at men who are essentially professional cyclists. You're on your bike 8-10 hours a day, and there did appear there was maybe a slightly higher than expected rise in the PSA in that first 6 to 12 hours afterwards. So in general, PSA not affected. I don't worry about guys who ride the bike a lot. We still get a PSA anytime and expect it not to be affected. Now, what can happen from bike riding, depending on the saddle and the seat that you use, is erectile dysfunction. There's pretty good evidence that if you're not in the right fitted saddle or seat, you can affect the nerves, and which then can affect the blood supply to the penis, and then it can have a harmful effect on erections or worsening of erections, or even developing pain and or numbness in the perineum, the area that you sit on. So that definitely can happen. Really important that you get the right fit on the saddle or seat.
How do you interpret, or can you discuss a little bit free PSA versus total PSA?
Yeah. Okay. So question was what's the difference between free and total PSA, and how do we interpret those? So when I talked about the PSA reference ranges, we're talking about a total measurement of all PSA in the body. In reality, there's many different proteins produced in the prostate that get released into the blood. One of them is free PSA. There's pro PSA and others. So we can actually measure all of these and use those to help figure out if a PSA is abnormal or concerning. So free PSA is something that we tend to see more of with prostate cancer. So if we get that level and compare it to the total PSA, we get a ratio that can help decide if we need to do additional tests or do an MRI or do a prostate biopsy. Again, this is a good topic, and certainly any questions about that, particularly if you're getting your PSA done on a regular basis. In general, free PSA does not need to be checked in the beginning. It only needs to be checked if your total PSA, your initial screening test, is on the high side.
And I think this was in regards to supplements, but the question is, what about tamsulosin, which of course is different?
Yeah. So someone had a question about supplements, or in particular tamsulosin. So tamsulosin, otherwise known as Flomax, is the trade name, which is one of the better trade names for medications, I might add, for in the case of urology. Tamsulosin is a prescription medication designed to kind of open the channel so that the bladder, open the channel through the prostate so the bladder can push the urine out easier. So it's a prescription medicine, can only be given either by your primary doctor or urologist. Has definitely proven benefits, will improve the flow, improve emptying, overall improve symptoms in the vast majority of men. But again, that's one of several classes of prescription medications that your doctor or urologist can prescribe.
Are there any genetic markers that can be tested to determine the risk of developing prostate cancer?
Yeah, so the question is, are there genetic markers that can be used to predict the risk of prostate cancer? There are a couple. They're not readily used, not fully studied. The only time really we're doing genetic markers in prostate cancer is when there's a very strong family history. So you have brother, a father, or two brothers who all developed prostate cancer early age, very aggressive, spread early, maybe someone died from prostate cancer. In those scenarios, it is recommended for sure that not only do you do the usual PSA testing and screening, but you also get genetic testing. There are certain genes that make someone more likely to develop prostate cancer or develop a prostate cancer. That is usually less than 5% of all men. So the genetic testing is not readily done when we're talking about screening or checking for prostate cancer. But certainly if you have a strong history in the family, that is a conversation to have with myself or any of the other urologists. And I guess one other thing we should mention on genetic testing, and I don't know if that's coming up in there, we do have some good genomic or genetic tests on testing prostate cancer once someone's been diagnosed. So we can actually do testing on the actual prostate cancer cells if they're detected to determine if they're going to behave more aggressively or less aggressively. There are several ways to determine aggressiveness on a prostate biopsy, but there are several genetic tests, some better than others, and more coming to help determine if someone has cancer, do you need to get treated or not.
And a gentleman maybe around the age of 70, would taking beta-sitosterol or a supplement be a good idea if they have no symptoms? Does it prevent?
Okay, so the question is, if someone's older, maybe a gentleman in his 60s or 70s, maybe doesn't have too much in the way of urinary symptoms or very mild urinary symptoms. First of all, that gentleman would be lucky to be 70 and just have mild urinary symptoms. But is there any benefit to taking a supplement such as beta-sitosterol? And I would say it's unknown. The one thing I tell patients about this, whether they're young or old, is that at least beta-sitosterol has been studied enough that we think it's safe. It's a plant, essentially it's a plant cholesterol found in a plant, in several plants actually. It's found in different fruits and nuts and seeds. So it appears to be safe. It does appear to exert its effect inside the prostate to reduce growth a little bit. So if you had mild symptoms even at age 70, I would say, yeah, you can try beta-sitosterol and take it in the appropriate dose and see how you do. You certainly may not need to be on prescription medicine if your symptoms are mild. So that's the approach I take with most patients of any age.
And a couple questions along the same line. Does an active sex life or frequent ejaculation help keep the prostate healthy?
Okay, good question. So does an active sex life or frequent ejaculation improve prostate health? And the bottom line is we really don't have any evidence that it improves prostate health. It doesn't reduce your risk of prostate growth. It doesn't reduce your risk of prostate cancer, but does not appear to be harmful in most of the studies done. So bottom line is that is, I would say, maybe more on the emotional side of things and in relationship side of things. That probably is important aspect that to your overall healthy lifestyle that may be important, but not a direct effect.
Are you taking new patients?
Oh, the question is, am I taking new patients? Yes. Yes, myself and my partners here at Rocky Mountain Urology, we're always happy to take on new patients. Even if you have any concerns that you think may not be major, we're happy to see you and talk to you and answer any questions you have.
This is a good one. Once a TURP has been performed, will the prostate continue to grow, necessitating another procedure?
So the question is, once a surgery has been performed called a TURP or transurethral resection of the prostate for enlarged prostate, and I didn't go into detail on the different surgical options. TURP or transurethral resection of the prostate is still kind of the gold standard for how we surgically treat enlarged prostate, to open the channel and physically remove tissue on the inside of the prostate so the channel is more open and easier for the bladder to pass the urine out. Any surgery you do, including TURP and even the newer technologies that use different ways to ablate or remove the tissue to improve urination, eventually the prostate will grow back. And so the key to a lot of these treatments, in particular surgical treatments, is longevity. Does it improve my urination for 3 years, 5 years, 10 years, 15 years? The more long-term procedures for enlarged prostate for men who either don't want to take medicine or the medicine doesn't help enough, things like TURP or aquablation is a newer one, tend to have much longer 8, 10, 12, 15-year data to say, hey, yes, the prostate will grow back, but it may take a very long time. Gets back to one of those early slides I showed where if your body is making testosterone, which it is in virtually all men, even into your 70s, 80s, 90s, the prostate will continue to grow. The rate of growth may slow a little bit, but it's still going to continue to grow. So you still have to monitor urinary symptoms down the road, even if you've had prior surgery to treat.
Does a UroLift operation, and maybe speak to also like vaporization or aquablation, make the diagnosis of prostate cancer more difficult?
Yeah, so very good question. So would a surgery or procedure to treat enlarged prostate and improve urination, would that make it more difficult to diagnose prostate cancer or catch it? Yeah, so and generally I'd say the answer is no, but really important if you have urinary symptoms, again, usually going to be due to a very enlarged prostate or an enlarged prostate. It is imperative if you're over the age of 45, 50, that you get evaluated for prostate cancer along the same time, because you want to make sure that prostate cancer doesn't exist before you go in to have a surgery for prostate enlargement. Because if treatment for prostate cancer can be more difficult if you've already had prostate surgery. In general, with the different options we have to treat prostate cancer, it's not a major problem. If you have had a prostate, a TURP or aquablation or UroLift 5-10 years before. But in general, we really want to evaluate men for prostate cancer prior to jumping into any type of surgery.
And I'm not, someone requested we go back into the slides on the page on symptoms. I'm not sure if we have that availability, but just maybe highlight again, once again, symptoms of
Prostate enlargement.
Yeah.
Yeah. So the question was, can we kind of review the symptoms that come with an enlarged prostate? And again, prostate cancer rarely causes symptoms, and if it does, it's probably very late in the course of prostate cancer. So the symptoms that men get urinary are almost always related to prostate enlargement. There's a whole host of symptoms that we can kind of summarize into 5, 6, 7 different types. One would be the force of stream, or the stream is getting slower and slower to the point that it's bothersome or taking too long to urinate. It could be urinating too frequently. That could be during the day. It could be too frequently at night. That can happen for a number of reasons, but if it's happening day and night, it's usually because there's enough irritation from the prostate enlargement that the bladder muscle's not emptying all the way. So you're retaining some urine. If you hold on to some urine and don't empty your bladder each time you go, you're going to fill up quicker and you're going to have to go more frequent. And then what can develop, a symptom that can develop later in the course of urinary symptoms, is urinary urgency, where you get an urge to urinate, and maybe when you're 40 years old, you can hold it and say, no, I still got 2 more hours to drive. But when you're getting your 60s or 70s and you get the urge, it comes real quick and you have to pull off the road. That urgency is actually a result of changes in the bladder muscle, where the bladder muscle has gotten thicker over time to push the urine out try to keep it going at a normal rate. But as the bladder muscle gets thicker, it also loses elasticity and it doesn't stretch as well, so that your bladder gets 2/3 full and your bladder's already starting to say, I can't, it's hard for me to stretch more. And if you wait too long, it's you can even start leaking and some drops of urine before you get to the bathroom. So urgency to go, any of these that are, you think, above the normal and really starting to affect your daily life or affect sleeping, that's a sign, better get these checked out. Tell your doctor, ask to see a urologist, and that's it. Those would be the key early symptoms to be aware of.
Why is a transperineal biopsy done in an operating room?
Yeah, okay, good question. So the question is, why is the newer type of biopsy, what we call a prostate transperineal biopsy, being done in the operating room? So it can be done in the clinic. We have chosen here, when we started doing this a year ago in our hospital, we chose to do it under anesthesia in the beginning because it can be quite uncomfortable for men unless there's the perfect amount of anesthesia used in terms of local numbing, needle numbing of the skin, of the muscle around the prostate and the prostate itself. So it is definitely being done in the office, and eventually we may do it in the office, but we thought in the beginning, as we're transitioning patients into this new type, it would make much more sense to do everything in a very controlled setting where we can put you under light anesthetic, much like colonoscopy does, and do everything in a typically 10 to 15 minutes at most to do the biopsy. So bottom line is we're doing it that way now. We found it to be a patient satisfier. They really enjoy that. It's a recovery and everything has been really quick, and patients are amazed, particularly patients that had the transrectal biopsy prior and now the transperineal can't believe the difference in recovery and how easy it is. But certainly in Europe, in some areas they're doing this in the office, and even some places in the United States that are doing it in the office.
That's it.
Okay.
That's all the questions.
Excellent. All right. Some great questions. Great questions from everybody. So, again, please, I got some final, let's see, end of housekeeping here. So, really important. We'd love to hear feedback on these presentations. We want to kind of bring to you topics that are most important to all of you out there. So if you could take a few minutes to fill out the survey, and it'll appear right after the webinar has ended. So take a few minutes. We want to hear from you. We want to hear other topics that you might want or other questions that you may have. Usually within about 24 hours of this, you'll receive an email that will have a recording attached. If you want to go back and listen and say, oh, I missed some things or didn't understand it, you can go back and watch it and then let us know if you have questions after that. And then please stay tuned for future Valley View presentations in urology and other specialties. So thanks again for joining today, and I hope to see you all soon.